Welcome to our Ed webinar, Learning Loss versus Disability, Navigating Special Education Identification in the Post-Pandemic Classroom. Today's Ed webinar is sponsored by Presence. Presence is a leader in special education-related services. By providing innovative solutions, Presence can help expand your capacity to assess and address students' special education and mental health needs through remote assessments and teletherapy services, truly creating equity and access to these important student supports. And now I'd like to pass things off to today's moderator, Kara Arundel.
Thank you so much. My name is Kara Arundel, and I'm a reporter for K-12 Dive, where I focus on special education, early childhood education, education funding, and Congress. I also authored the booklet, Recruit and Retain Special Educators with Real-Life Lessons from Local, District, and State Initiatives, published by LRP Publications in 2020. I'm thrilled to have you all with us today for this important conversation. To set the stage for our talk today, I want to ground us in some data, and then I will introduce our panelists to share their experiences and perspectives with us. Over the past few years, the educational landscape has shifted dramatically as a result of the pandemic. Schools are still adjusting, and one of the key areas to address is how to properly assess and evaluate students to see if they need additional learning supports in a post-pandemic world. From learning loss to behavior to mental health, the pandemic has impacted our students' growth and development, and we're still learning the extent of its effects. Parents and educators have seen these effects firsthand. According to a recent survey by Talker Research, 2/3 of parents are concerned about their child's growth and development post-pandemic. Asked to rank what concerned them the most, they said emotional well-being, social development, future preparedness, behavioral issues. In fact, 85% of parents notice something worrying about their child at least once a month, while 20% say it happens every day. Many fear their children simply aren't catching up, and those fears are valid according to research. According to a recent report from the Center on Reinventing Public Education, academic recovery is happening too slowly. Too many students whose learning was most severely interrupted during the pandemic still aren't getting the support they need to recover. The fact that so many students are facing these challenges makes it harder to distinguish between temporary setbacks and deeper learning disabilities that may require long-term supports. And low-income students have more ground to make up. These challenges are hitting communities that have historically had less access to special education resources the hardest. At the same time, the number of students who need or who are requesting evaluations is growing. According to recent research by the National Center for Education Statistics, the number of students receiving IDEA services in the United States increased by nearly 1 million students in the last decade, making up, so that student population makes up 15% of all public school enrollments. While there are more students receiving services across the country, at the same time, more students than ever are in need of assessments, whether due to learning delays, behavioral challenges, or mental health concerns made worse by the pandemic. And because of the pandemic, many students miss critical early intervention opportunities, which means schools are playing catch up. More students could benefit from evaluations today than at any time before. At the same time, schools are grappling with how to clear the backlog of assessments and ensure that each child receives timely, accurate evaluations. According to the National Association of School Psychologists, the recommended ratio is 1 school psychologist for every 500 to 700 students. However, in reality, the national average is closer to 1 psychologist for every 1,653 students. In some areas, this ratio is exceeded by up to 10 times, making it extremely difficult for schools to keep up with the demand for assessments. Limited resources, staffing shortages, and the sheer volume of students needing support have left many schools struggling to keep up. These challenges impact not only the students, but also their families and the educators who are trying to meet their needs. The stakes are high, and schools must find ways to streamline the assessment process without compromising the quality of care. Together, the data begs the question: how can we ensure all students receive the targeted resources they need, regardless of underlying causes? To help us unpack these pressing challenges and explore potential solutions, we're joined by a panel of experts who bring a wealth of experience from different corners of the education ecosystem. Together, they will share insights into how schools can manage this growing demand for evaluations while ensuring that no student is left behind. First, we have Dr. Jacqueline Rodriguez, CEO of the National Center for Learning Disabilities, where she leads a team at the forefront of the learning disabilities rights movement. As an esteemed educator and professor, Dr. Rodriguez has taught at the elementary, middle, and high school levels and served as a special education faculty member at the School of Education at William & Mary. Dr. Rodriguez has prepared countless educators in equity-driven assessment practices and progress monitoring based on each student's individual needs. Our second expert is Robin Lake, Director of the Center on Reinventing Public Education, a nonpartisan research and policy analyst organization at Mary Lou Fulton Teachers College at Arizona State University. SERPI's mission is developing transformative, evidence-based solutions for K-12 public education. Robin's research focuses on U.S. public school system reform, including public school choice and charter schools, innovation and scale, portfolio management, and effective state and local public oversight practices. Our third leader is Bonnie Contreras, who serves as a Senior Director of Clinical Solutions at Presence. Bonnie began her career in education as an elementary school counselor, holding additional positions as a school psychologist. Joining Presence in 2019, Bonnie provides education on the implementation of teleassessment and teletherapy services to support districts' special education and mental health needs. She has presented at national and state conferences on remote assessment and virtual counseling supports. Bonnie has also engaged in legislative advocacy, seeking increases for school-based mental health funding. Now that we've introduced our panelists, let's dive into the heart of today's conversation. As we've outlined, schools are facing a perfect storm: a growing backlog of evaluations, an increase in students needing special education services, and the need to incorporate more comprehensive assessments that consider both academic and mental health needs. So to navigate this landscape, we need strategies that not only address these immediate challenges, but also build a stronger, more resilient system for the future. So to kick it off, I'd love to hear from each of our panelists, what is one change you've noticed in how schools approach special education assessments in this post-pandemic landscape? And Jackie, would you like to start us off?
I'd be happy to. I'm so grateful to be joined with Bonnie and Robin and you, Kara, in thinking about this not only important topic, but very timely discussion. And when we think about public school assessments, I think about it in comparison pre-post. So prior to COVID, what were we looking at? And then post-COVID, what perhaps are the biggest changes? Our team at NCLD has done some significant data collection on this. And what we've noticed in particular is that there are an actual increase in assessments post-COVID. That shouldn't be surprising. You know, the backlog you just noted is immense. And so I think all of us are essentially catching up to what was going on when we were remote. That being said, you know, early in COVID, we were all in the disability community asking for some patience and grace when it came to identification around student progress, because we didn't want to overly identify students with a disability when perhaps there was a different factor involved, some sort of issue with regard to COVID, particularly chronic absenteeism, language, cultural differences, et cetera. What we did notice in 2022-23 school year, however, and not necessarily a bad thing, but something just to note for everybody, is a 12% increase in students identified under IDEA as receiving services for special education. And so that's about 7 million students across the country receiving IDEA services for one of those 13 disability categories. And that was an increase from 2018-2019, pre-COVID, which is about 6.3 million students. I think we could also argue that 2019, perhaps that's not an accurate assessment of the nation's needs because we still had a backlog even then. But I am really happy to see that we have done some mining of that, and the students that are in need of services are getting them now. Um, just of note, if you're thinking about, well, where's that increase happening? Is there a disability category in which we're seeing increases more than another? So our organization, the National Center for Learning Disabilities, of course, represents those with learning disabilities. And we think about attention as well, and those co-occurring disorders of emotion, anxiety, regulation. And in truth, we only saw in the public school system a slight decrease in students with learning disabilities being identified, but a significant increase in students with autism being identified post-COVID. So that's where we're seeing the most students receiving services that are new in the post-COVID era. I'm going to point folks later to the Calder Center, who has some really immense research around this. And we can perhaps talk about specific states that are either doing a really great job or maybe some states where there's some growth that we should ask for.
Great, great. Robin, what about you? What's one change you've noticed when considering special education assessments post-pandemic?
Yeah, thank you. It is, I just want to say again, wonderful to join this panel, and thank you to all the folks who are participating virtually, and thank you for your work on the ground. I know so many of you are teachers and special education leaders, and just want to thank you for doing the work that we're all talking about and know is so important. So I guess I wanted to just build on what Jacqueline just talked through, because that's where I think the big issues lie right now, and where we need to zoom in. We've been looking at the data as well, the same rise in identification rates. We do a lot of work with school districts, talking with them about what are the issues they're grappling with, how are they trying to address learning loss, and all of the challenges that kids are bringing in the door post-pandemic. And what we're hearing from them is, we've been hearing for a while, special education rates will continue to climb. This is just the start. I do think that, Jacqueline, you talked about the kind of under-identification probably that went on during the pandemic. Now we might be getting some over-identification. And I think what we hear from practitioners, both in the general ed and special education world, is kids keep coming through the door with significant impacts and challenges that may or may not be related to an actual disability, but the only structures we have in place to really kind of meet their needs is special education. And so the movement is toward the programmatic approach. I think that's worth us all sort of grappling with today and talking through whether that makes sense. Personally, I think we need to kind of bust that open a little bit, because it's a lot to put on the special education teams. Even if they're working in tandem with gen ed, it's just a lot. And for them to be the solution for all of the issues that kids are grappling with is tough. I also think that what we're seeing in the data is that there's no end in sight, that the little kids who were essentially COVID babies are still coming into the system and entering kindergarten. We think that we know that they didn't have access to preschool at the same level as kids normally do. They certainly didn't have normal socialization, et cetera. And so the developmental delays as well as the academic delays are real, but they may not have a disability. And so my concern is, again, we're foisting this off on, kind of a small team of folks in a school that has a limited set of funding, a little limited ability to address all the kids' needs. And it's not necessarily the best route for the kid. I think what we're grappling with at SERPI as we're looking at the data is this is a big problem. This is a long-term problem. And it's not just a special education issue.
Great. And Bonnie, again, what's one change you've noticed how schools approach special education assessments post-pandemic?
Yeah, thanks, Kara. And here to my fellow panelists. I agree with everything and hope that I have something meaningful to contribute. And I also want to thank the participants and was tracking as closely as I could as the information was coming through. Lots of directors of special education, lots of teachers, lots of school psychologists, holla to my people, a handful of people from Kentucky, also my people. So excited to share from my perspective, not only as a school psychologist and school counselor, but also working in the virtual space. I think one thing that became very clear is the value of these comprehensive psychoeducational assessments. We saw a significant, number of just waiving of those evaluations during COVID. And it was really, how do we solve this? How do we maintain compliance both at the federal and state levels, but bypassing maybe that 3-year process where we're getting updated indicators of student progress. And I think in absence of that, we've seen a real impact to the frontline educators that the comprehensive evaluation that is really then going to drive the creation of that individualized education plan was absent. And so do we just sort of continue with what we have? Do we try to make our best guess based on just sort of general observations or feedback that the student and parents might be giving us? So I think it really highlighted the value of the approach for determining eligibility for special education. Jacqueline, thanks for nodding your head. I love it. And I think something else that really, is important to consider when we look at sort of, these broader implications is harking to what Robin was saying, that when we have universal learning loss, and what do we do then at the fundamental foundational level? Where do we sort of take that step back and look at universal programming? And I'll certainly give a plug for MTSS, which I'm a large fan and have worked in a lot of different states and have helped to stand up those programs. But I think when we look at this, what are we offering as universal invention when we look at curriculum, when we look at approaches? I think that's going to be really critical to address students who've experienced invariably some level of impact and adjusting those systems earlier, which is then going to allow for us to determine, with accuracy, those that are showing true learning disability or other qualifying categories.
Great, thank you. Robin, I want to turn back to you about SERPI's State of the American Student Fall 2024 report, which provides insight into the current educational landscape. What specific hurdles are schools encountering in differentiating between learning loss and deeper long-term learning needs? And you already spoke to it about over-identification, under-identification, but what can you pull out of your research regarding that differentiation?
Mm-hmm. Well, one trend I want to note is during the pandemic, I think we all were so aware of the intensity of this challenge ahead of us. And many of us talked about not going back to normal, figuring out a way to really think differently about schooling as a result of the shock to the system, recognizing that things weren't going perfectly before the pandemic. Too many kids, weren't progressing effectively, and there were changes that were needed in the special education system as well as other places, so that the adults and students could thrive together, and that we all could help the professionals do their best work. And I think that one trend that we're noticing in all of our studies is that we so quickly went back to normal. And so I don't get the sense that there is enough conversation about these distinguishing factors that we're all talking through. It's sort of, the machine continues, and the people who are working, within that system are doing their best to make it work, but we really haven't rethought those structures and systems. And so I think a lot of folks are struggling, and we see that in every data point. When we talk to teachers, we survey them, they're overwhelmed, they're dealing with staffing challenges, overwhelmed by the needs at hand, et cetera. So that's one thing that I think is just a factor. I think the other thing that we're seeing in terms of shifts that schools are grappling with is there are a number of things that have happened since the pandemic that are kind of becoming a little bit hardwired into our systems. First, won't surprise any of you, especially those of you who are in schools, but absenteeism. The idea that school may be optional, chronic absenteeism is really on the rise. It's just harder to get kids to attend regularly and therefore learn. That's a big one. That's a big hurdle. The staffing challenges that I mentioned just continue on. And I don't just mean in terms of shortages, but I also mean just in terms of morale and burnout kinds of issues that, everybody's exhausted. This was just such a trying period, and it continues to be trying, and it will continue to be trying, especially as money gets tighter. And then the other kind of shift is around what I would say just expectations for kids. And I don't mean really at a personal level, but I do think that a lot of schools and school systems understandably took their foot off the gas when it came to academic expectations for kids. And I think, I as a parent appreciated that certainly. And, happiness and well-being for our kids had to come first. But I worry now that we see in the data, kind of grade inflation and some signs that that we may not be holding to the same expectations in terms of academic preparation that we have in the past. And so these are a bunch of sort of big, kind of global hurdles that I'm worrying about. I'll just mention briefly that at the classroom level, where so many of you are working, I think, we're seeing, I alluded to a little bit of this when I was talking about special education versus gen ed, that, when it comes to meeting the complexity of all kids' needs right now, funds are walled off. So sometimes tutoring programs are funded by one set of funds and aren't available to kids who have an IEP. That's a little bit crazy. Kids who could benefit from special ed services don't necessarily, qualify for them, even though that could be a benefit to them. Kids, of course, who are pulled out for services don't have access to the same academic time as other kids. These are not new issues, but these kind of walls that we've built between special ed and gen ed and programs and funding sources and staffing structures and things really aren't serving kids well right now. And that's what we hear from teachers. And so these are some of the barriers. There, of course, there are so many more, but I guess maybe I'll mention one more that I hear from teachers on a regular basis, and I think relates to this question of sort of academic acceleration that we're all concerned about right now. So many teachers have told us over the years that they struggle with the tension between helping kids really get to mastery and fill holes, and being able to stay on pace in their pacing guides and hit the end of year assessments. And that's always been a tension in education, but I think right now it's a particular one. And I think it's a major hurdle when we're talking about addressing kids, just holes in learning or developmental needs. Can we take the time to slow down so that we can accelerate them faster going forward? I don't think our system is set up to allow us to do that.
Great, thank you. A lot of hurdles and challenges, and we're going to talk about solutions as well. But Jackie, I want to talk about NCLD's recent report, The State of Learning Disabilities, which highlights that feeling accepted and supported by at least one educator in high school significantly boosts success for students with learning disabilities. However, it also notes that educator biases and lack of understanding can be barriers to student success. So, what steps can schools take to better train educators in early identification and intervention and ensuring that all students, especially those with learning disabilities, feel supported and have equitable opportunities for success?
One of the more difficult questions to address, right? Because if I had the perfect answer, we wouldn't be having this conversation. I think it's important to note what you just said, care around all students, and then reciprocate that with all teachers. For many, many years, decades probably, we've always said kids who are in special education or special ed kids. And even just those two statements denotes that those students are separate from the general ed environment and from the general ed teacher. And I don't think that every general ed teacher feels that way, but it's like the old adage, if you continue to say something enough, people start to believe it. And so in this case, identifying student learner variability is the hallmark of a great teacher. To be able to identify the different learning needs of all of your students, whether those needs amplify to a disability or perhaps an exceptionality, and there are gifted and an extension work that we can be doing, or to Robin's point, due to COVID or other factors, learning loss, migration patterns, loss of a family member, chronic absenteeism, you have gaps in your instructional needs. Every student's going to need something different, and every educator needs to be prepared to address that. That is a tall order, to say the least. It's Herculean and almost impossible given our public school system circumstances with teacher shortages, with the compliance orientation of services, and the need to keep up with pacing, and the recognition that we're trying to ask a singular person, in some cases two people, to address all of that at once. So I don't say it flippantly. I have those in the audience that are special ed directors and special ed teachers like I fully empathize and recognize that we're asking you to do nearly the impossible. And I think it goes to back what Bonnie and Robin are saying around the infrastructure. The system isn't set up right now to address all of the learner needs that are in the system. The system has to get redesigned in an effort to actually meet the needs of every kid. Given that, right, what can people do right now? So the report from NCLD was around youth and transitioning into adulthood and perhaps into the workplace. And of course, we're looking specifically at kids with learning disabilities within the IDEA supports and the special education system. That's about 30 to 35% of your students. So it's a huge populace to consider. And as you mentioned, we realized in the past, teacher instruction, even family support to a degree, were larger predictors of school outcomes. That's changing. That report, 1,300 young people from 18 to 24 with learning disabilities provided their feedback, and they did cognitive interviews. Belonging is the single most important predictor of high school graduation. And it's the single most important predictor of if you go into a post-secondary college or post-secondary education environment for you to matriculate to success. And that belonging has to do with not just a teacher thinking that you can do it, that you're important, that you had a unique value add. It's also your peers. So bullying in school is still a huge indicator of health within a school system. And when bullying takes place with a peer, students feel less likely that they're included and they belong. Now take it another level. We don't often call bullying with teachers because we would never imagine an educator would do that. But the perception from a young person of a teacher thinking that they can't do something or they're not equipped to, or making a supposition about them without asking, feels very much like a pejorative factor. right? So a lot of students that do feel like they have been bullied in high school have been bullied in high school by their teacher or peer. They don't graduate. 76% of those students that had significant bullying did not graduate. It's a huge proportion of kids. If we think about now, what to do, like as a school psychologist, as a school counselor, as a special educator, when there are few and far between of us still, right, in the school system, how can we as an ecosystem beyond related service providers, inclusive of general educators and administrators, what can we all be doing to make sure that that student feels like they belong, not only are they included, but they have a unique contribution? We identified 4 areas that we would probably suggest to every school system. One was pre-service and in-service supports, professional development around how learner variability impacts your facilitation of instruction, how students engage with the instruction, and how they demonstrate competency. Very basic universal design practices in schools. So if we're not going to dually license every educator to be a special and general ed expert, then everybody needs to be prepared to learn how to instruct students across the board in their classroom. And that's difficult, when funds are low and teachers are asked to do a lot. But those types of professional developments, and at the root of it, preparing educators for that environment is going to be the best solution overall. We talked about academic and social interventions that support students, and in particular, cultivate that sense of acceptance in an inclusive environment. And then we wanted to incentivize students with disabilities in particular engaging in advanced placement and IB classes, which we know the rates of engaging in or even being allowed to participate in are so much lower than their general ed counterparts. It's a travesty, right? So that is another way to help students feel like they belong in that classroom and they can be successful. And then finally, as a school system and as a school leader, administrators can start thinking about really ambitious graduation rates, post-secondary enrollment rates, and starting from the very beginning, employing that kind of goal setting with their educators and having educators discuss, talk, and demonstrate pathways towards those outcomes. That includes parents. So we'll talk more about parents later, but that is a school leader's sort of endeavor, is really pushing those big annual goals.
Great, excellent. And Bonnie, I wanted to ask you, with Talker Research's recent survey showing that 53% of parents believe their children are still behind nearly 5 years post-pandemic, how can technology-driven solutions such as remote assessment tools provide more accurate and scalable supports to identify students' needs, particularly with the challenges that schools are facing?
Yeah, excellent question. I want to say real quickly in response to Jacqueline that the idea of inclusivity and belonging extends to all of us on this call. And for those of you that have taken an hour out of your day to join us, you belong here. And I think that times of great challenges and need generate solutions that we didn't know existed. So in many ways, in talking with Jacqueline and Robin before today, I think exciting things are on the horizon. So, as a parent, Kara, I think this question is something that I reflect on both professionally and personally. Observing my own students, I had my oldest graduated in 2020 without a graduation, without the traditional fanfare, no prom. She is a senior at the University of Louisville, go Cards. And just even observing the impact to her, right? We're very much focused on sort of this K-12 space. And I really appreciated the comments that Robin made about our youngest students having missed some of these sort of core socialization opportunities. My youngest is now 16, and it certainly has really drastically impacted his experiences compared to my other 2 children. So it's been quite something. But I think when we consider technological implications, it is very much part of the solution. It is not the solution, but it is a critical piece to solving this, I think, for a couple of really important reasons. we're able to, as professionals, extend our reach to students, who may be in, geographically isolated locations, urban areas where we know that there's, substantial staffing shortages beyond even what we experience in sort of traditional environments. And so just by eliminating the physical travel, the actual space to meet with these students can be so powerful. It makes me think real quickly of a conversation I was having with a special education director in the interior of Alaska. And we were sort of talking about working inside of sort of the cultural expectations of Native students there. And someone came in. She said, "I have to leave. The plane is here." She jumped up, grabbed her parka, and the chair was spinning, and out the door she went. So I started just thinking about just the reality of her physically to get to some of the locations that she supports involves a bush plane, right? The fact that those students are assisted through a virtual application. They do not really have the prejudice that the adults often do for that virtual interaction. I think also that there are certainly workforce-driven wants, and that it essentially expands the efficiency of the practitioners. And let me explain that a little bit further. But as a school psychologist and school counselor, I really sort of split the reality of general education intervention and special education, which is sort of that wall that Robin, one of the walls that Robin was talking about. And sometimes I felt like I was sitting squarely on that wall and sort of helping students here, and then we shift them over here. But I had a lot of other tasks that were not necessarily specific to my specialized training or my background. That important tasks, to be sure, but prevented me from really working at maybe the top of my training and skill. And so, when we look at the virtual application, being able to take an individual that may reside in rural Kentucky, but who can carry licenses in other states and meet the needs of students is really, really quite powerful. And then I think finally looking at the student view, which is I think the most critical, is really meeting students where they are. And again, so much of what I do in national and state presentations is helping my peers and colleagues see the value of technological incorporation, particularly with remote assessment and delivery of related services in a remote fashion. I rarely encounter a student who expresses those same concerns. So I think that sometimes we have to be very flexible. We have to be open to the paradigm shift that this is something our students are easily going to adapt to. They come preloaded really with the necessary skills to be successful in a virtual interaction. And if we can sort of park some of our concerns, which are valid and need to be addressed, and we need to be mindful and adhere to best practice. But for a student receiving a virtual assessment or a virtual counseling session is as good, and I would actually argue for some students can be even a superior experience.
Excellent. Great. Jackie, I want to go back to you and about, using evaluations designed that are accessible to all learners. What suggestions do you have for schools and districts wanting to incorporate accessible, culturally and linguistically responsive frameworks into assessments?
That's a really important question. I super appreciate the fact that we're talking about this, because we started off the discussion thinking about how many students are being identified now. And I think if we all tease the data out, we would believe that we still haven't identified everybody. And yet we all discussed, there are over and under identifications based on how people are actually applying assessments and what they're thinking about. So right now, my experience in the public school system recently has been that more often than not, students with language needs, so seeing students who are English learners, are being assessed for special education services, either in tandem with receiving EL instruction or TESOL instruction, or without it. There's almost an expectation that, like, if the student has a language need, that perhaps we can support them better with special education services. And I'm not sure if those are conflated issues. They have traditionally been conflated. There's a ton of research on the fact that kids with second language acquisition may not acquire English as quickly as they learn their native language, but are quite brilliant, and when assessed for special education are over-identified in a space like a learning disability, when in truth, they're cognitively taxed with two languages and trying to manage facilitated instruction in both of those languages. So what we've seen for teachers in particular around like school districts, what they can be supporting is really thinking about the cultural implications that the student comes to the school with, and then aligning practices to those implications. So for example, if a student is immigrating to an area from overseas due to the countless wars that are taking place, some of those parents are going to be culturally and physically displaced from their native areas. They're coming to a school system somewhat in dire straits. Those students may even be translators for their parents. And as those parents start to navigate our version of public school, teachers are still thinking about whether or not parents are engaged or disengaged, but they're doing it based on cultural norms that the US has put in place, not necessarily cultural norms from other nations. And so we have to be really careful about the judgments or the criticisms that we apply when we see or do not see specific parents at those meetings or can't get in touch with specific parents because of that. The other piece here is our IEP system for those who have either been identified or in the initial process of being identified for a special education service is still very culturally normed toward the white middle class, maybe even upper class parents and students. And so we're not even just describing those who are coming to our country, rather those who are in our country and have been for generations and still are not aligned with what is the predominant culture in that system. And so we've been doing a ton of research, and there's just some really beautiful studies on culturally responsive IEPs and how parents can be involved, not just from the moment they walk in the room to discuss the IEP, but rather from the moment their student is being identified by the teacher as potentially needing additional supports. So Bonnie said it beautifully. MTSS is in theory and in practice, when done with fidelity, a just fantastic system to address learner needs. So if we're bringing parents in at the very beginning, we're identifying the pathways, we're describing each of the steps, and they are alongside with us as co-collaborators in the process, then when they get to the IEP meeting, they're not feeling as though it's a them and an us. They're also not feeling like, I can't ask questions because I don't understand. I don't want them to know I don't understand. They're feeling like, I helped you make this IEP goal because I've been along in the seat next to you the entire time. And we're able to really communicate beneficial IEP goals and beneficial services because parents are not just engaged participants, but they're active, bought in investors in the student's IEP. And that goes for every kid, but in particular around communities of color and communities where we have immigrant populations who may not be completely aligned to this very specific norm that we have with the IEP system. So I would really encourage folks to think about culturally responsive IEPs and how to embed those practices in your school systems, in addition to the fact that, we have IEP meetings typically either during the day, which are work hours, or right after school in support of teachers. How can we leverage, to Bonnie's point, technology? How can we encourage everybody to come together so that we're in each other's space, but perhaps we're doing it where everybody can participate and there's no strain on the family to do so?
Right, thank you. It goes back to what Robin and you all said about changing infrastructure and thinking differently. And then we want to leave time for questions from our guests. But Robin, I really wanted to ask you about SERPI's recent report, which showed that in some places strategies are working to combat learning loss and aid in academic recovery. Great news. Can you share some examples, some insights from those findings, please?
Definitely, yeah. And the challenge with the State of the American Student Report is it can be a little depressing if we don't talk about the bright spots. There are many, and the good news is recovery is happening in places. It's not enough. It's not fast enough. We need to do more, but we can build on success. So what's interesting is that if you dig into the places that are rebounding most quickly, they're doing things that won't surprise anybody who's looked at the research and who has seen kids respond to things like tutoring, evidence-based literacy and math strategies and curriculum, more time on task. So things like summer school programs, after school programs, and data to inform intervention. So strategic use of data to be able to target interventions to kids most in need through the systems that, that are proven to work, that we've talked about briefly already today. So that's kind of that should be good news to everybody. The things that we think matter do matter. We should be doing more of them. The challenge, I think, comes in, how do you get that to scale? How do you get that to kids, all the kids who need them? And how do you accelerate the impact of those strategies, especially given that times are tightening in terms of the fiscal opportunities with the federal dollars going away for pandemic recovery? And there, I think we see some good news as well, that people are using strategies to do things like getting kids back to school regularly, addressing chronic absenteeism through programs like the BAR program, Building Assets, Reducing Risks program. There are proven programs out there that just get to the heart of the issues, the root causes of absenteeism. And there are school districts who are doing real-time testing of different strategies across different schools to figure out, in their community, things might look a little bit different. So they're going to try and test programs to attack chronic absenteeism. We also know that engaging students and parents, as my colleagues have discussed, is just really critical. There are innovative technologies, so just to build on the conversation, but AI is developing, the generative AI movement is developing a number of tools that I think are especially well suited to our most complex learners, especially kids who have IEP and other risk factors. Other issues going on with them. So these are emerging tools. We have to be careful with evidence, but we need to be trying strategies like them. And the last thing that I'll mention is on staffing. I really, we keep talking about tearing down the walls. I don't think we're going to be able to give kids what they need unless we do that. So we really are serious about universal design for learning, being able to really meet kids where they are and accelerate them, boost them up so they're well positioned for the future. I do think we have to start playing with staffing structures. And so there are a number of schools and school districts around the country that are really developing teams that go beyond just a co-special ed gen ed teacher, but a whole group of folks who might include experts from the community who are coming in and helping to triage needs and bring in assets wherever they may exist in the community in service of the child. So those are some of the things that I'm most optimistic about and excited about. And I think they should give us all hope.
Excellent. One more question for our panelists, and then I'm going to let the audience ask questions, or I'm going to ask the questions from the audience. But as we wrap up, each of three of you, can you name one strategy school or district, schools or districts can begin exploring right away to help make sure they're meeting the needs of the students? And if you could keep it quite short and succinct so we can get to the audience questions, that'd be great. And Bonnie, would you like to start us off?
Yeah, I'd be happy to. So I think, we've been talking about multi-tier system of support, which is a much larger subject, but we're sort of speaking to the academic reality, but then also the social emotional development of the children and how critical those are. And, citing Jacqueline's comment too about, that belonging is really this critical key factor for this success, that I think the value of the MTSS approach for that behavioral level setting for the district and schools universally is so important, that we are setting expectations, right? There has been this, we talked about it on the panel, this idea of sort of stepping off the gas. I loved whoever said that, but that, we need to be clear in providing the instructions and framework for how these students can be successful in their post-school life, in their communities, right, in their professions, within their family units. And, schools have taken on a large task of getting the youth prepared for that future. But I think that deploying the strategy of MTSS in, specific to those behavioral and social emotional supports is so critical. And I see them as just going hand in hand. And just real quickly, Robin, I love all this. Like, I'm imagining you as like Wreck-It Ralph, but then you're going to get really good and we're going to rebuild everything beautifully. But I think not only are there the challenges in schools with these walls coming down, but within the communities. And you said that there are models that are being developed. And I am familiar with what you're describing, sort of these wrap services. So it's honestly, Karen, not even just inside of the schools that we need to become more transparent and cohesive in our work. It's across the whole community, including the family as a critical stakeholder.
Excellent. Jackie, would you like to go next?
I'd love to. So I'm going to take it one step further. I'm going to agree with MTSS 100% and then encourage school district leaders and teachers to say, hey, we want to see more young people involved in their own services and their own discussions around what benefits them, what supports them, what's not helping them, and what's not supportive, and then ask families to contribute to that too. I'm living in Massachusetts right now. We've just gone to a universal approach where students at a specific age will be invited to their IEP meetings with this intention that they're not only talking about their disability, owning their identity, not having to face a stigma about it because the entire school is in recognition that we all have learner variability, but they're also contributing factors to their IEP or their 504 plans. And we forget sometimes that the people that we're serving are also our partners. And so I'm just going to push in for, students being engaged in this and families being engaged in this. And the state of Ohio, I think, is doing a pretty good job of bringing parents of kids who are receiving services into systems and helping them actually create policy around that in school systems. So parent and student involvement to a much greater degree is going to be my strategy.
And Robin?
I love those. I will just add, I keep thinking that at the heart of some of the issues is that we're not really giving parents and students honest information about where they are and where they could be and what would be needed. My own son had an IEP, and rarely did I get real information about how he was doing, what he was mastering, what he wasn't. And rarely did I get kind of a really high bar. And so I really think that one of the best things we can do right now is to really be honest with parents and students about where the holes are in terms of developmental development, academic development, and also set a very high bar and say, your child can get here. And we're committed to doing that. But we need to start with the reality of where things stand. I'm really worried about parents, getting report cards and IEPs that aren't telling them the real deal. And that makes teachers' jobs harder, I think, because parents don't think there's a problem.
Great. Thank you. Thank you all. Let's take a question from the audience. Audience member asks, do you think that adding SEL, social emotional learning curriculum, to a required subject would help the teachers address behavior issues or mental health, such as anxiety issues in the classroom, essentially allowing the students to learn in a safe space and reducing the need for special education supports? Who would like to answer that first?
I'd like to just jump in real quick. As someone who was so passionate about providing the support to the general staff and all of the schools that I was in, I should say, I was a military spouse. I worked in a lot of states and districts, not because I wasn't doing a good job, but the Army was moving us every 2 years. And the power of giving the tools to the educators, the paraprofessionals, the staff that is providing the support to the cafeteria and the custodians. I always wanted everyone to be included, to buy in, because if we're all engaging in these practices with a universal curriculum, and we're developing norms as a group, the stigma is honestly extinguished. And there is so much power with that, Kara. And I really appreciate the question from the audience member that, teachers that I engage with and talk to, the challenge around executive functioning, making good decisions, understanding how to appropriately interact with their peers or adults in their environment. These are very real challenges that, quite frankly, if they aren't addressed sufficiently, it makes the whole task of academic instruction much more difficult. So I would say that the value of being very intentional, very proactive with incorporating this into the general education setting, whether it's a specific class that it's tied to, a certain time of day, it's within the homeroom, the outcomes will be, significant and positive.
Thank you so much. Robin, Jackie, do you have anything to add to that?
I would love to just give we have the evidence to suggest what Bonnie is saying and what the question is being posed is accurate, right? We have an entire generation of students right now in the disability rights movement who have grown up in an era where social emotional learning was a thing in public schools. It's becoming more of a thing, but they were part of that first generation. And I cannot tell you how many people are calling themselves disabled. I'm a learning disabled student. I'm an autistic student. And this is not just appropriation of language, it is an appropriation of identity. SEL instruction has allowed students to see themselves, their whole authentic selves, as exactly what they bring. And that's exactly what they should be. And so the evidence is obvious and already indicates that that kind of SEL instruction reaps benefit on everybody in the community.
Thank you. And Robin, do you have anything to add in short time?
The only thing I'll add as a researcher is that the evidence on different SEL curriculum is a little bit light. And so while there's a lot of evidence that SEL matters, I think we're still trying to figure out what's the best way to approach it in classrooms and in a way that doesn't put SEL and academics at odds. They shouldn't be. They should be in tandem. So that's a challenge that I see folks grappling with that we'll have to continue to gather evidence on.
Excellent. Thank you all. This has been such an insightful discussion. I want to thank all of our panelists for taking the time to join us today. Jacqueline, Robin, Bonnie, thank you so much for sharing your expertise, insights, and strategies. Keep the conversations going. I think everybody's homework is to watch Wreck-It Ralph today. And thank you to all our guests. Thank you for joining us. Thank you for recognizing the importance of this conversation and this work. As we wrap up, like I said, I encourage everybody to keep these conversations going, reflect on how these strategies can be applied in your own work.